It's 6:30 on Friday, the 2nd of March. This is Good Morning Ulster with Declan Lawn and Joel Taggart.
Now, have you ever heard of a condition called the Celtic Curse? It's a genetic disorder called Hemochromatosis that people of Irish origin are at higher risk of having. In fact, it's thought that as many as 1 in 8 people on the island of Ireland are carriers of the gene. Our health correspondent, Mary-Louise Connolly, has been speaking to consultant hepatologist Dr. Johnny Cash. She began by asking him to outline exactly just what is hemochromatosis.
Hemochromatosis is a term that indicates iron overload in the body. 90% of individuals with hemochromatosis will have hereditary or genetic hemochromatosis, and a small number, about 10%, will acquire hemochromatosis through blood transfusions or taking too much iron supplementation.
So what are the typical symptoms?
Most people early on don't have any symptoms at all. However, fatigue is the most common symptom, and then organ disease can develop over the course of time. For example, joint pains, liver disease and diabetes would be the most common. Other patients will develop colour changes of their skin, and some patients will develop heart disease.
How serious can it actually become for a person? I know everybody's different, but in the most serious of cases?
Well, thankfully for the majority of people, they don't come to serious harm, but if the disease is undiagnosed over the course of a lifetime, it can lead to very serious harm and even death. That's very uncommon before the age of 40 or 50. In gentlemen, we would typically not see symptoms or significant disease until they're in their 50s or 60s. For females, it's a wee bit later because they protect themselves through menstruation and pregnancy.
What about treatment? When a person is diagnosed, and of course you can be diagnosed as having the gene, but you may not display the symptoms. But for those who do have the symptoms, how are they treated?
So it's very straightforward. It's venesection, which is the removal of about 400 millilitres of blood. Traditionally, we would have disposed of that blood. However, in Belfast, we've had a pilot study for a number of years now where we're utilising that blood. We're going to try and roll that out in association with the Health and Social Care Board, NIBTS.
So it's good blood?
Absolutely, it's good blood. It's exactly what patients who require blood would need. There is no mechanism by which the disorder can be transmitted through blood to other individuals. So we will be looking to roll this out across Northern Ireland in the future.
Basically, a patient who is a carrier and who has the symptoms, they're carrying too much iron around in their blood and their organs just can't cope with it.
That's correct. The human body is designed to have no mechanism to excrete iron, and genetic hemochromatosis basically prevents the body from limiting the absorption of iron. It absorbs a little bit too much every day, and over the course of a lifetime that accumulates in the organs in the body and causes the disease.
And it is referred to as the Celtic Curse. Why is that?
Well, the Celtic Curse refers to both the prevalence and incidence of the disease in the Irish population, but also the genes have been detected back as far as the Neolithic era in a lady who's just south of Omagh in Ballynahattie. 2 gentlemen in Rathlin in the Bronze Age about 4,000 years ago were also found to have the genes. I think the Celtic Curse title has come from the combination of those factors.
Why all of a sudden are we talking about hemochromatosis?
Well, hemochromatosis is no more prevalent now than it would have been in the past. However, we're getting better public awareness of the condition. Word of mouth is certainly playing a part. The Hemochromatosis Society, which is a patient-led society, and of course modern techniques in terms of detecting genes is playing its own part through family penetrance.
Now, anyone who's listening to this and feels that they may have some of the symptoms or they want to get tested, what should they do?
So I recommend that they have a conversation with their general practitioner. The GP will assess whether it's appropriate to take an iron test and or the gene test. The gene test would not be done in individuals without an iron test unless there's already an index family member affected. As of yet, we don't population screen for this condition within our population.
Well, that's the next question, isn't it? Should Ireland be screening for this gene? Surely we're in the right place to do that, and people should know if they are carrying it.
It's a very good question, and I think would remain a controversial question. We've got to consider lots of factors when we screen for populations. The effect the disease has on individuals, the fact that this gene doesn't penetrate in every individual who has it. About 20% of people who have the genetic profile will never develop the disease. And if we screen the population, we could be identifying those patients and giving them unnecessary concern. We would also need to consider costs of screening. Each gene test costs £16, and if we were to screen every adult in Northern Ireland, that's a substantial amount of money.
Well, after 8 o'clock, we'll be talking to Mary-Louise about this Celtic Curse, hemochromatosis. She's been hearing from a patient who was diagnosed at the age of 18. Now, earlier in the programme, if you were listening, we heard about a genetic condition that people of Irish origin are at higher risk of having. While dubbed the Celtic Curse in more medical circles, it's called Hemochromatosis. In fact, it's thought that as many as 1 in 8 people on the island of Ireland are carriers of the gene. If undetected, it can be serious. Well, our health correspondent, Mary-Louise Connolly, has been finding out more about it, and she joins us on the line this morning. Morning to you, Mary-Louise.
Good morning.
Well, it's a new one to me, I have to say. So what exactly is it?
Well, Joel, it's a genetic disorder which causes the body, the bloodstream specifically, to absorb an excessive amount of iron. The iron is then deposited in various organs, including the liver, heart, pancreas and the joints. And when this happens, there's iron overload, and really the body doesn't like that. I've been talking to Shenna Lundy, who's now 25 and working as a nurse in Uri. She was diagnosed when she was only 18, and she told me how the condition makes her feel.
I remember babysitting for my cousins feeling really lethargic. I would have been babysitting and falling asleep on the couch. Like, that was never me. I always would have been active and, out for walks and gym and everything. So I had no energy, and then really started getting joint pains in both my hands, round toward my knuckle areas. Even just moving them, it was really painful. And I couldn't understand what was going on.
Mary-Louise, we know this is hereditary, and people may be listening to that this morning who haven't heard about hemochromatosis before will be thinking, my goodness, I feel like that. Maybe I have the Celtic Curse.
Exactly, but we know that around 1 in 8 people in Ireland are thought to carry the gene, but that doesn't necessarily mean, Joel, that you'll be affected physically like Shenna was describing there. However, we're told that around 20,000 people in Northern Ireland are displaying symptoms, that they're living with the condition, and once diagnosed, it is treatable by monitoring diet, but in more extreme cases, it's treated by a process that's called venesection, which involves removing blood from the patient and therefore lowering the amount of iron within the body. Now, what I've found out that it's once a person is diagnosed, it leads to other members of the family being tested, and then that's when the questions start arising. When people look back on their family tree, that they say perhaps great uncle Joseph had displayed some of these symptoms, but we're only really hearing about it now, and more people are being tested. Just like Shenna, she talks about the death of her grandfather, who died aged 61 of a massive heart attack.
Initially, when he passed away, I didn't know I had it because I was quite young when he died. But then I began to think, well, if I'm a carrier of it, my mummy is a carrier and my father's a carrier, well, then it must have to link back in the family history. So mummy started thinking, God, maybe did your granda have this gene and have hemochromatosis and never knew about it, because if it's left untreated, it can affect the heart and the liver, causing liver cirrhosis and heart failure. We don't know if he had it or not, but we were sort of surmising that he might have had it.
Mary-Louise, one of the more curious elements of this is this Celtic Curse name. I mean, do we know how far back that goes, where it comes from?
Well, that's due to the prevalence of the gene in Ireland. Between 1 in 8 and 1 in 12, I'm told, have it. Also, the number of people in Ireland who are actually living with symptoms. But also, this is the really interesting bit, Joel. Bodies that have been exhumed dating back thousands of years in Ireland have also been found to carry it. Dr. Johnny Cash is a consultant hepatologist at the Royal Victoria Hospital, and he's been talking to me.
The Celtic Curse refers to both the prevalence and incidence of the disease in the Irish population, but also the genes have been detected back as far as the Neolithic era in a lady who's just south of Omagh in Ballynahattie. 2 gentlemen in Rathlin in the Bronze Age about 4,000 years ago were also found to have the genes. I think the Celtic Curse title has come from the combination of those factors.
So I put it to Dr. Cash, should we not be screening for the condition?
It's a very good question, and I think would remain a controversial question. We've got to consider lots of factors when we screen for populations. The effect the disease has on individuals, the fact that this gene doesn't penetrate into every individual who has it. About 20% of people who have the genetic profile will never develop the disease. And if we screen the population, we could be identifying those patients and giving them unnecessary concern. We would also need to consider costs of screening.
So Dr. Johnny Cash there, and this really is one of those stories that once you start talking about it to friends and colleagues, that you realise more people actually have been diagnosed with it, and strangely enough, just really in the past year or so. So that's your word for today, Joel, hemochromatosis. I'll not ask you to spell it. And of course that story will be told in pictures tonight on BBC Newsline at 6:30.
Mary-Louise, thank you.